New Zealanders can purchase the weight loss drug Wegovy from pharmacies tomorrow, providing they have a prescription. But it will cost between $500 and $600 a month, according to estimates. Wegovy is related to Ozempic, made famous by celebrities like Oprah, who attended Jeff Bezos' wedding over the weekend. In fact, commentators dubbed the extravaganza the Battle of the Skinny Waistlines, as A-lister after A-lister showed off their newly trim bodies. Wegovy and Ozempic are brand names for products containing the medication semaglutide, which works as an appetite suppressant. I spoke to Royal College of GPs President Dr. Samantha Merton a short time ago and asked her who can get a Wegovy prescription.
Anyone who has meets the criteria, and the criteria are to have a weight that meets an obesity scale of over 30, so your body mass index has to be over 30, or it can be a little bit lower than that if you have other conditions that relate to obesity.
Okay, are you predicting a huge run on this? Do you think there's going to be a lot of demand?
I think there will be a lot of demand, but as you say, it's quite costly, so people will still have to pay a decent amount of cost to take the medication, but there has been quite a bit of success for people who have really struggled with their weight for a long time, or having side effects of being so overweight that they need something to help get on top of things.
Yeah, I wonder if you feel that you qualify and you've looked at the criteria and then you go to your GP, do you think that generally they will be open to prescribing it, or could they potentially say no?
I think people will be open to prescribing it, but we are very cautious because no medication is without side effect, and some of the side effects of these weight loss drugs are quite significant. So we do have to be very cautious in the way that we go ahead. Some people who have had problems with their pancreas, we wouldn't be prescribing it for them. And then there's other cautions as well that we need to keep an eye on. So it's not automatic that if you meet the weight guidance that you can have the medication.
Can you talk me through what some of those side effects are?
Yeah, so some of them are, we need to keep a watch on your liver function tests, make sure that other medications that you're taking are not interfered with by the way that Ozempic or Wegovy slows down how your gut functions. We also keep an eye out for pancreatitis and any abdominal pain. Some people will get terrible diarrhea and various other side effects as well. So those are the main ones that we keep an eye out for.
What is the difference between Wegovy and Ozempic that we've heard a lot about?
Yeah, so these are Ozempic and Wegovy are the brand names for the medication, and the underlying medication is exactly the same. They're both made with the same active ingredient, so people will use them interchangeably to a certain extent.
People might see it as a sort of a weight loss quick fix. Will there be checks and balances to make sure that it's not just handed out to everybody?
Yeah, I think there will be some monitoring of how it is prescribed. I think as GPs we are pretty cautious in what we're prescribing to people, and I have had, there are other options available currently, and there's a small number of people who've come in to talk about that medication, but we do make sure that people meet the criteria. The other thing is that we do need to make sure that they are losing weight at the right rate, that they are injecting it appropriately, because it is an injection taken once a week into your skin. It can be done in different places, and some people find that really difficult as well. So it's not just a simple pop this pill, you'll lose weight. It's a little bit more complex than that.
Will there be a way for health professionals to assess how successful the rollout of Wegovy is down the line, presumably a reduction in people needing other healthcare services?
Yeah, I think what we will hope to see, if people are able to lose weight, that that when they're off the medication, that their weight will continue to keep going down or stay stable. I think the other thing is that often with these sorts of things, people get more active, and once they've dropped the weight off, they may find that their joint pains are much better, that we're not prescribing so many other medications that relate to carrying extra weight. And then the other thing is, like diabetes, we'd hope that those people who are heading for diabetes, we don't see as many getting into that category as well.
Royal College of GPs President Dr. Samantha Merton there. And Novo Nordisk, the company that manufactures Wegovy, has said that it will ask Pharmac later this year to fund the drug.